Hello again, everyone, and welcome to Health Center. I'm Lorraine Brooks, and I'll be your host for today's show. Today we're going to be doing a part 2 of our series on cultural competence. We had done a previous show with 2 of our occupational therapy master's students here at Downstate, and on the set with me today are 2 other occupational therapy master's level students who also worked with the previous 2 students on a series of cultural competency videos that I think are just very interesting. We here at Downstate have a very, very diverse population, not only as patients, but we have a very diverse workforce here at Downstate. I've been working here for 26 years, and I remember when I first came here in 1988, one of the things they told us at new employee orientation was that they were very proud to say that we had employees here who spoke over 15 different languages, and that was a lot back in 1988. Now here it is 2014, 26 years later, and we have people who speak over 50 different languages working right here at Downstate Medical Center. So that just goes to show you how we in Brooklyn and we as an institution have become so much more culturally diverse. And it's really important for us to recognize the differences among people as well as the similarities among people. So my guests on today's show are 2 occupational therapy master's level students. Elizabeth Selden, welcome to the show.
Thank you.
And Esther Arden, welcome to the show, both of you. I understand that you worked with Musia and Danielle, and that together you were working on a series of videos to illustrate the importance of cultural competency. I know we talk a lot here on campus about cultural diversity because we think it's important to understand that that you cannot always assume something about someone just from looking at them. What religion they are, for example, what sexual orientation they are, where they might be from. And so that's about diversity, but this is about competency, which is a little bit different, yes?
Yes.
How so? How is competency different than diversity?
Yeah. Diversity, I think of it more as a noun, like it's you can describe it by, maybe people looking different. If I see a group photo, I could see diversity right in the picture.
Okay.
But competency is more about a verb, about doing, and we've talked a lot about it being a lifelong process that begins with awareness. Like, you don't need awareness for diversity, but you need awareness of yourself more than anything else for competency, and looking into your own value system. Also trying to think of each person as an individual, because 2 people that look alike may be you treat them very differently, and that is cultural competency. And we learn that it's you never really achieve cultural competency. It's always
so you mean it's always
you're always learning. Yeah, all of us that did the video, as we encountered new situations, we just always talked about it and realized, we have more to learn. You can never really say I'm culturally competent now.
So it's about how you, the therapist, or you, the healthcare provider, see your patients and how you interact with them. Would you agree with that, Elizabeth? That it's more about doing than knowing?
Yes, it's a very dynamic process, so you're constantly learning, and you learn through doing. So
I know that you did a scenario that involved some, what you're calling unintentional language. And we're going to show a clip of that, but if you could just talk a little bit about what does that mean, unintentional language? How can I speak unintentionally? I don't know if I understand that. When
we first started this, I think all the 4 of us were not even aware, how many things we say. Like, I might have thought, I always think of the other person, but in the course of this project, I realized no, whatever you speak about, it comes from your perspective. And unintentional is you haven't really seen it from the other person's perspective. So if I have some assumptions, I might say a word like retarded, for instance, and that's a loosely used word, almost like a slang in our society. especially by younger people, like in undergrad, you know, you hear a lot of people just throwing it around in campus. As you walk across a college campus, you might hear the word retarded like 25 times when you go from one building to another, but none of them mean it in the sense of talking derogatively about somebody being of lower intelligence.
So the word, just to pick up on what you said, the word retarded has come to be a sort of, not really a put down, but just sort of a joke almost.
Yes.
You know, that when you call someone retarded, you don't really mean that they're retarded.
Yes, exactly.
You just mean that they've done something silly or they've done something without thinking about it. And why would that be offensive to somebody, you think?
Well, because if they know someone who is actually retarded, then you're almost putting them down as if that person's just silly.
So if for example, and I say this all the time, you can't assume anything about anyone in New York. New York is just so diverse and so cross-cultural that you can't assume anything about anybody. So, for example, you might be talking about, and I had a situation in my office a few years ago where there was some difficulty. I think it was before you guys got here. There was some difficulty with a grocery here in the neighborhood that was owned and operated by some Korean people, and the community was accusing these people of treating African Americans differently. When an African American was in the store, they seemed to be a little bit more suspicious of that person, and they would sort of follow them and sort of make sure they weren't stealing anything or whatever. And word got around to the community, and so they were boycotting. And in the process of this boycotting, I was interviewing somebody in my office for some other reason, and we got on the subject of this boycott that was going on with this Korean greengrocer, and he used a word to talk about the Korean people that was offensive to me. And I stopped him and I said, "You can't use that word in my office." And he was very taken back. He was like, "Well, why not? I'm not talking about you. You know, I'm talking about these other people." And I said exactly that to him. I said, "But you don't know who I'm married to. Exactly. You don't know who my best friend is. You don't know who lives next door to me. And I might find that offensive just because there's somebody in my midst who fits that, you know, who belongs to that group. But even so, even if you don't, it's still kind of offensive to use unintentional language, isn't it?"
It is, and I mean, you know, I think the first time you learn it or realize it, from that moment it does become offensive when you hear it, even if you don't know anybody, like it is for me now. The minute somebody uses the word retarded, I always pick up on it, and I'm not always sure whether I can step in or not, depending on the scenario, but it is always offensive to me.
Well, that brings up another point, and Elizabeth, maybe you can address this. What do you do? I mean, suppose you're in a situation where people are talking about something and they're using words or phrases or calling names that are offensive to you. What can a person do?
Well, I think people generally shy away from stepping in to say, "Hey, that offends me." But it's perfectly fine to approach someone and say, "You know, the way you use that word, it doesn't really sit right with me, and this is why." And just take the opportunity to educate the person why it can be offensive to certain people, and that they should be more mindful of the language they use when they're in the public.
So let's take the vignette that we're about to see, which speaks to a particular situation, and you use the word retarded. And in the vignette that we're going to see, someone refers to someone's language or decision or behavior as retarded. And the patient is not comfortable enough to really address that. And as we said before, there are no right or wrong ways to do that. Is that not right? I mean,
correct.
There's no right way or wrong way to say, "I'm offended." So what do we do? I mean, we encounter situations all the time where people in authority or people that we think are in authority are using certain words that, not, as you say, unintentionally, not that, you know, it's not that they mean any harm by it. So how do you do that? I mean, I don't know how I would address my doctor, let's say, if she said something that I didn't like. And just the fact that my doctor is a she,
Right.
You know, a lot of people, when they speak to me and they say, well, what did your doctor say about this or that? And they automatically assume it's a man. It's not, it's a she. So I have a little bit different relationship with her. But what if she were to say something that I found offensive? How would I?
I think it's perfectly fine for you in a very polite, casual way to just say, you know, you said this, but I really prefer if you use this kind of language, because to me, the word you used really incites this sort of emotion. And I think that's perfectly fine.
Also, I now have started to use a tip that one of our professors gave us, Dr. Kaplan, who's also a faculty advisor for our project.
Okay.
And she always says that when somebody says or does something, especially says something that doesn't sit right with her, she asks this question, what did you mean by that? You know, and that's like a nice, you're not correcting them, but you're putting the responsibility on the other person to tell you now. Like, if I were traveling with somebody and who said the word retarded just in casual conversation, and I said to them, you know, as they threw it out, I know they're not meaning retarded, but if I said, oh, you know, Cindy, what did you mean by that? Now, that person doesn't feel awkward or corrected, but at the same time, they kind of have to explain.
They have to explain.
And then they could say, oh, I just throw this word around, which is actually the scenario in our classroom, one of the classroom vignettes that we had. We had two possible ways to correct a person. And one of the ways was a classmate said, you know, I find that offensive. And then the person who used it said, oh, I'm so sorry, my brother throws that word around, and I guess I just picked up on it.
Okay. Well, why don't we watch the scenario and then we can come back and talk about it a little bit.
In this vignette, we'll see a common classroom interaction.
Okay, take a break. Come back in 10 minutes.
Ooh, Sarita. Yeah. These were the exercise shorts I was telling you about. The ones that make me smell like a cab driver. It's super gross.
Oh yeah, there's a guy on my block who smells like that. You have to get rid of that. But I've seen a lot of people wearing these shorts.
I don't know, I tried those on once, but they look kind of weird on me. Like, they make me look hippie.
Oh, don't be retarded, Naomi. I'm sure they can't be that bad.
I don't know, maybe I'll just wear them when I'm running by myself so nobody will see me.
Hey, do any of you guys have the notes from lecture 3?
Yeah, I do. Did anything happen that could make someone uncomfortable? Let's watch the scene again. Yeah, I've seen a lot of people wearing these shorts.
I don't know, I tried those on before and they look really weird on me. Like, they make me look really hippie.
Oh, don't be retarded, Naomi. I'm sure they're not that bad.
Yeah, Sarita, I don't mean to sound obnoxious, but I really don't like when people use that word. It's kind of not cool.
Oh my, Naomi, I'm really so sorry. It totally just slipped right out of my mouth. But you're absolutely right.
It's okay, don't worry about it.
Questioning people's use of language can be difficult and awkward, but in today's multicultural society, we should be open to comments or discussion that are in the end molding us into more aware people.
Ooh, I like this.
Don't be retarded, Naomi. Those are way too expensive.
Yeah, but they have them in purple. I don't know, maybe I'll just splurge this time.
I don't mean to interrupt. I know you didn't mean anything. I'm not sure you meant that word the way you said it.
What word?
Retarded? Kind of offends me the way you say it like that.
Oh my God, Lauren, I'm so sorry. My brother's been throwing that word around the house all the time, and I guess I'm just picking up on his bad habits, but you're absolutely right. Thank you for telling me.
No problem.
How would you have handled it?
So we just saw the scenario where the word retarded was used and the person was very uncomfortable about it. And I think you were absolutely right in what you were saying beforehand, which is what Dr. Kaplan said. It's okay to ask the person, what do you mean by that? But how many of us really do that, Elizabeth? I mean, how many of us really in practice do that? It's very difficult.
It is difficult, and maybe it's more that you yourself have to make the conscious effort to take this, the opportunities to be culturally competent and point out to people by saying, what did you mean by that word?
Well, if I used the word, let's say I used a racially charged word, but I didn't really mean it to be racially charged. There are words that we use that mean certain things to some people and not to others. And if I'm in the habit of saying that word and it's offensive to someone else, but it's offensive, it's not a non-offensive word, like retarded is not quite as offensive as a racially charged word. How do you think we would handle that situation? Would the, what do you mean by that question?
Yeah, you mean if I were the person who found it offensive?
Yeah.
I might ask them, why do you use this word? And has anyone else told you that it's offensive to them, or am I the first person, because I find it offensive, but has anyone else told you that before? There's always a first time, maybe the person who's using it was never really told by anybody, because we are all like so politically correct, we don't want to correct anybody. But something like that. And I think it also depends on your relationship with the person. How you would correct somebody or question them depends on your, the mutual relationship.
Right. And, you say that, and that's very true. We interact with people all the time that we're not necessarily, that we don't know very well. And you might not feel comfortable correcting someone that you don't know very well, whereas somebody that you do know very well, you might feel a little bit more comfortable. There was another scenario about unintentional language that you did as well. There was the one with the word retarded, and what was the other one?
Yes, the other scene is an outpatient clinic where the therapists are talking about a politician in front of the patient. And it's just the idea that, as a professional, if you're having these conversations and kind of talking bad about saying you don't like the politician, the patient's overhearing that, and what if the patient really supports that politician and their views? You've now made the patient feel uncomfortable because that patient is now thinking, oh, well, they're not in line with my thinking, and they actually think I'm wrong for thinking this way.
And politics is an interesting thing, isn't it? It's very divisive.
It's a very charged subject.
Exactly. We tell people all the time not to discuss patients in the elevators, for example, or anywhere in public, or not to discuss anybody's diagnosis, or certainly not to mention anyone's name, and also political views, because they can be very, very, as you say, very charged. Well, why don't we watch that scenario, and then we can talk a little bit about that afterwards also.
In this vignette, we'll see an interaction at an outpatient clinic.
Last week, you're going to use this hand, and you're going to pick the beads out of the putty.
Oh my, oh.
Oh, let me help you, Rose.
I'm sorry.
Sorry about
So what were you saying about the race for mayor?
Well, just so, based on all of the things the other guy did, you'd have to be a total idiot not to vote for Susan Walker. She's a much better candidate. She's a great speaker. And seriously, who would you vote for? That other guy is a total moron. Look what he did to the city's budget. I just think he's suckered so many people into liking him, and people are lemmings, just waiting in line to fall off a cliff.
Yeah, well, he's just a little bit too gay for my taste.
Yeah, hi. Can we talk about this at lunch, please?
Sure.
Never would even be even better.
Sorry. I'm done.
Great. Okay, so now we're finished with this, and you're going to move on to taking these, also with this hand.
Has anything been said that could make someone uncomfortable?
So here we are, back after having seen both scenarios where unintentional language was a major issue. I wonder, as OTs, well, first of all, let me step back a little bit and ask you, what made you choose Downstate? I'll ask you first. What made you choose Downstate as an OT program?
Well, I grew up in New York City, and I knew that I wanted to stay in New York City, and Downstate is just a very cultural place. There's a lot of diversity here, and all the schools that I've gone to growing up in the Bronx were also very diverse.
So we're very fortunate, aren't we, to be here in New York to learn about
Yes.
so many different kinds of culture. Do you find that that has enhanced your education?
Yes, immensely, because you constantly learn every day new situations, interacting with people and all the diversity that you see.
Was it similar for you?
Me, actually, I have like more of a personal reason. I've had 2 children.
I'm guessing you're not from New York.
No, I mean, I'm not from the United States, obviously, but I came here about 20 years ago, and I've moved, I think I've lived in 12 places, moved a lot. This is my second career.
Okay.
I was in computer software before. But I came to New York about 6 years ago, and actually that it was around that time I was dreaming of being an occupational therapist. And I had a chance encounter with somebody who was an occupational therapist in S.U.N.Y Downstate. In fact, because my son had special needs, S.U.N.Y Downstate had called me as a possible family contact to place a person who was doing like their EI fieldwork, early intervention, sorry.
Okay.
EI, early intervention, when my son was, it's when a child is 0 to 3. And this child, this therapist who was studying at S.U.N.Y Downstate would come to my home and observe occupational therapy being done to my son in an effort to, you know, like the field work that we currently have. So that drew me to, I asked her questions about S.U.N.Y Downstate, and I think I went to 6 open houses before I actually, you know, applied. And I think I'm...
What was it because, were you attracted to Downstate because of its diversity or because of that?
To be honest, no. To be honest, it was the encounter, and it was also the location. I could get here in 20 minutes, and I had a little child, and I couldn't make the commute to like NYU, nor did I have the money. So it was partly for the price and location. And I mean, whenever I looked it up online, it had a wonderful program. It was not like that I was going to pay less and not get a good program. I was getting a superior program for the best price.
Well, that's a wonderful endorsement for Downstate. Thank you. We always try to attract new students, and one of the ways that we promote ourselves is by saying that when you come here, you get a very broad-based education, and part of it is because of the diversity of not just our patient population, but our student population and also our staff. Do you mind if I ask you where you're from?
I grew up in Mumbai, India.
Okay. And is it very different here for you as a person who is not from the United States?
I think in India, we didn't know about cultural competency or anything like that.
Why
but
not?
we also did not discriminate, because in the same building in which you live, there's a Hindu, a Muslim, a Parsi, a Jew, a Christian, and you all go to each other's functions. And I think because of that, like India already being a diverse place, just in terms of religions though, I wasn't aware of the subtle other issues until I came to the US. You know, I'm sure I made a lot of mistakes in my first year or first years of life in the US. Must have said a lot of mistakes. Like verbally, I might have said, I don't remember now, but I'm sure I said a lot of terrible things to people because the unintentional thing, you know. But I think also I had much more tolerance built into me, because I had always, I mean, I didn't have any homogeneity in the friends I had. You know, I went to a school in which there were all kinds of people, and we had uniforms, so there was no rich and poor, there was no distinction between religions, and so
you feel like that helped you? It
helped me, yes.
Did it help you to growing up here? Do you think it helped you to understand issues that you're facing with your patients better? I mean, coming from someplace else, you might not have the footing, but you have the footing. Do you find that helps you?
I think it definitely has helped me, because I've encountered different cultures and different races, different ways that certain families do things one way and not another, and so it's really helped me be cognizant of how to approach that and just kind of ask, like, well, how do you do things? And, you know.
Give me an example of something that you might need to ask about how you do something in a family situation.
Oh, well, maybe something as simple as, who's the person that prepares the meals? Is it the traditional, is it the mother, or is it a family that both parents worked, and now both parents, you know, every night they come together to figure out who can put dinner on the table for the children, who had to work late and who didn't tonight.
What does an occupational therapist actually do?
Yeah, we always, that's a
That's
good
the
question.
million-dollar question.
We're still in the process of preparing our elevator speech, which is individual to each person. Like what comes to, what I'm trying to, you know, make as my kind of motto statement about occupational therapy. And to me, I can just give you what I would say. I would say that ultimately occupational therapy is just to get a person functional to as close a functioning capability as they were before the injury or accident. Or in the case of a child, you want to help their parent, you know, maybe the child is developing, so you want to help their parent, help them to develop the best they can. But in case of someone who's lost something they once had, the occupational therapist helps them to get back function, whatever that, in whatever way that may be. If the muscle, if you can't bring the muscle back into action, you might use some adaptive device that the person could use just so that they could eat or bathe. So ultimately occupational therapy just gives you back your occupation in terms of like function.
Okay, well that was a great explanation, thank you. I always learn so much when I interview our students. I don't interact with students, I really work with employees. So I don't get a chance to interact with students, and I'm always fascinated and very humbled at the professionalism and a knowledge base that you guys have. So thank you very, very much for being on the show today. I hope that it was a good experience for you. It was for me, and I hope that our studio audience learned a great deal. We'll be back with you next time on Health Center. I'm Lorraine Brooks. Thank you for watching.